are the Rohingya? The Rohingya are often described as the world's most persecuted minority. They are an ethnic group, majority of whom are Muslim, who have lived for centuries in the majority Buddhist Myanmar. They are not considered one of the country's 135 official ethnic groups and have been denied citizenship in Myanmar since 1982, which has effectively rendered them stateless. What's happening? Due to ongoing violence and persecution, hundreds of thousands of Rohingya have fled to neighboring countries, either by land or boat, over the course of many decades. Residents and activists have described scenes of troops firing indiscriminately at unarmed Rohingya men, women, and children. The UN, as well as many rights groups such as Amnesty International and Human Rights Watch, have consistently decried the treatment of the Rohingya by Myanmar and neighboring countries. 809,000 Rohingya have fled violence and persecution in Myanmar to seek refuge in Bangladesh. 9,000 Rohingya have died, most of them from violence in Rakhine State, Myanmar, according to surveys conducted in refugee camps in Bangladesh. 288 villages that Human Rights Watch estimates have been destroyed according to satellite data. 10,333 refugees, on average, have crossed into Bangladesh daily since August 25th. How is IMANA Medical Relief helping? IMR is helping by sending weekly teams of medical volunteers to Bangladesh under the umbrella of FEMA, Federation of Islamic Medical Associations, in coordination with local partners. Our volunteer doctors travel to Bangladesh to provide critically needed healthcare to the Rohingya refugees via mobile clinic outreach to the makeshift refugee camps. So far, IMR volunteers have treated an average of 2,000 patients per weekly mission.
I wanted to speak a bit about our Save Rohingya medical mission for the Rohingya refugees in Bangladesh along the border of Myanmar and Bangladesh. IMANA, as you know, has been committed to medical relief for quite some time. As you know, we've had 80 emergency medical missions around the world. We've treated over 2.5 million patients around the world, 8 hospitals we've built, 37 to 40 some emergency response teams. And first and foremost, I want to thank all of you who have supported our work around the world with 200 some projects taking place. But now's the time to really come together again for Save Rohingya. I have to admit, it's something that I thought I understood. I thought I knew what was going on, but until we actually stepped foot on the ground and experienced our time in the camps, did it not hit me the extent of dismay, the extent of tragedy, the extent of suffering, the extent of wanting hope until I actually visited there. I think what is always neglected in every single one of these crises that we have volunteered and have been part of, healthcare always is sort of forgotten because it's a special niche. And alhamdulillah, we were there, we were able to help them, to treat them, and then work with our partnerships on the ground and the ambulances that the donors have donated to funds for, and use those ambulances and then transfer them to the field hospitals. I wanted to share some of that with all of you today to motivate you to come with us, to join us, to be part of us, to volunteer with us, and also to continue supporting us with your tax-deductible donations so that we can continue to add teams and continue to add additional weeks and months to the calendar to help people. You need good-hearted people who are willing to volunteer, but you need big-hearted people who are willing to donate to allow for that to happen, so that together we can make a difference.
How can you help? Spread the word about the Rohingya refugees. Spread the word about IMR efforts to help. Volunteer or donate today, and let's save lives together.